questions as we're going along in the chat, or raise your hand, or if you want to speak, that's fine too. But I want to make it, more of a dialogue. So feel free to ask me any questions. So I'm going to start sharing my screen here. Okay. So can you all see this? Okay, I think it's loading. Okay, so I'm just going to start with resources. And again, I can't see everyone, so if you have a question, I would just put it in the chat. So yeah, I oversee our pre-health and pre-med advising program. One of the best ways for you all to stay in touch and be up to date on the most important information is to follow our Facebook page. And the reason I say to do this is because this is where we're posting job opportunities or information on how to get volunteer opportunities during the pandemic, or research or jobs or scribing, anything like that. We post a lot. Also, we post on the events page too. So when we come more to fall, when it's really busy, we partner with all the pre-health orgs at UC San Diego, and all the events are consolidated onto our events page on Facebook. So I know Facebook is kind of, a dinosaur at this point and for older people, but just know that this is where it's just the easiest place for us to filter information. And it's also kind of like a newsletter. So definitely follow our page. Even if you're not on Facebook, you can actually still look at it without having an account. So it's at HealthBeat UCSD. So go ahead and like or follow that. And this is an example of what our events page will look like. So for those of you who are transfers, we always have a transfer transition seminar. It'll be during week 1, and you'll get an email about that. But for transfer, is welcome to come to that, but it's really important for the transfers to really maximize your last 2 years while you're here. So we have a workshop dedicated for you. So all of that information will be on this events page, but we will also send you an email. If you're a new freshman or transfer, you'll get an email notifying you about this. But if you don't, like I said, it's always going to be on our events page. So I just wanted to paint a picture of what pre-med at UC San Diego looks like. So we have about 33.3% of students who go to UC San Diego who are interested in pursuing some health profession. And the reason I just like to show you all this is because it just shows there's so many students just like you who are really trying to navigate this complex path of pursuing med school or vet school or PA school. All of these programs are highly competitive. So it's important for you to get connected right away, because there's a plan. A lot of times I focus on coming up with a 2 or 4 year plan, depending on where you're at. You need a roadmap, and just like any map, it can change at any moment depending on what happens and how you do in OChem or physics. But you want to start off with some sort of plan, and starting as soon as possible, because this process can get very overwhelming. And so it's good to have a general plan. Like I said, it's okay if it changes, but I want you all to work with me or Nadia, who is our other advisor, to help create a plan for all of you. So just so you know, this is specific to med school. It's one of the more competitive health professional schools, but the national acceptance rate is around 40%. And our students who go to UC San Diego and get accepted into med school is also around 40%. So the main thing you have to keep in mind is just to be ready when you're applying. It's all about being prepared and being ready, taking all the classes. And through this presentation, I'm going to give you like a brief overview of key things you need to do to be prepared for med school or any health professional school. Again, feel free to ask me any questions. So this just gives you a picture of acceptance rates and how competitive things are. So 40% is MD. Also, there's osteopathic medicine. It's actually tougher to get into DO schools in many ways because there's not a lot of osteopathic medical schools. And this is podiatry, which most people don't do, but it has a very high acceptance rate. Same with pharmacy, if anyone's interested in pharmacy. PA is probably one of the hardest, if not the most hardest to get in, because there aren't a lot of PA schools, and they expect you to have a lot of hours when you're applying to be a school. So hours meaning you're worked as an EMT or you worked as a certified nursing assistant. You have a lot of patient contact hours. So that's the big difference between PA and like med. You actually need real hands-on experience. So you usually need to get trained in something or certified in something. Optometry is also easier to get into. I'm not trying to show you this so you go pick the school you want because it's easier. It's more just to give you a realistic picture of what it looks like nationally. So, and this is comparing like the national average to UC San Diego. We do pretty well overall. Oops. And then GPAs. So this is another thing. As you can see, the GPAs are pretty high for all health professions. I'm sure you're all not surprised by that. MD is always going to be the highest. And what this means is this is the average GPA of students who get accepted to these programs. It's an average, so of course it means people have lower than a 3.7 for MD or higher. But one of the things like I like to let everyone know is it's not just about GPA. I show you this because this is just the data, but you need all of these other things they'll consider when helping you prepare and get accepted to your health professional school of choice. But GPA and metrics and test scores are a big part of this. It's not the only part, but it's a big part of it because they need to know when you get there that you can actually handle it and manage the course load. So I'm going to talk about preparing for health professional schools in 3 parts. So the first part will be the academic prereqs. The second part will be the extracurricular activities, basically the things you're going to do to build your application. And then the third part is finding mentors and building relationships, because no matter where you go, what profession you choose to go into, you really need to have a mentor and someone that's willing to write you recommendation letters. And just so you know, at UC San Diego, it's a large school. It can be really hard to get to know your professors. So I encourage you to go to office hours, to reach out to them, to meet with them one-on-one, and to start building these relationships so they can get to know you, so they can actually write something about you that's compelling. So I'm going to take you through these 3 parts. And then again, any questions, feel free to send me in the chat. So generally it depends, of course, on where you want to go. If it's medicine or PA, it's a little different for every health profession, but generally these are some of the classes you can take or you need to take. So biology, all the labs, Gen Chem, OChem, calculus, stats, biochem, physics. So that's really the med classes. For like nursing and PA and PT, you might need anatomy, physio, and micro. And then if you are a non-bio major, that is okay. However, we still recommend taking an additional year of upper division biology, such as genetics, cell biology, and usually immunology or physiology, depending. But keep in mind, the prereqs are not just to get into any health professional schools. They're going to help you on the standardized exam you have to take. So whether it's the MCAT or the PCAT or even the GRE. So you want to take these courses. If you're a bio major, it's easy because it's sort of embedded into your curriculum. Non-bio majors, you don't have to be a bio major at all. You just need to know that these courses happen in a sequence, and you need Gen Chem before OChem. You need OChem before biochem. And so you need to plan carefully if bio is not your major. So again, I can help you with that if you have questions, but our saying is timeline is everything. So that means really knowing mapping out your coursework is part of mapping out your timeline. So again, important to remember, these classes prepare you for the standardized tests. It's not just prereqs to get into the school, they're actually helping you prepare for the exam. Now let's move on to part 2, which is extracurricular activities. So I talked already about creating an academic timeline, but simultaneously, I want you all to create an extracurricular activities timeline. And what I mean is I want you to plan out when you think you'll do certain things. It's okay if it doesn't happen as planned, but I want it in there so you know where you need to move it if you do need to move it. But generally, you want to get these 4 buckets of experience. So the first most important thing you're going to do, whether you're going into medicine, PA, pharmacy, nursing, you need to get patient contact experience. And what does that look like? It looks like working at a hospital, volunteering at a hospital or student-run clinic. You could be a scribe, you can be a medical assistant, a certified nursing assistant. Basically, you need to be working with sick people, people who are patients, people who need to be cared for. That's essentially what you'll be doing in any of the health professions. Now, if you're interested in dentistry or pharmacy, obviously you want to be in that type of setting. But any hospital experience is always going to be good experience because it's giving you exposure to the health professional field. So that is absolutely necessary, number 1. And now some students will say, well, how many hours do I need? And while many schools don't have a specific number, a lot of volunteer places do. Usually they have like a minimum of 100 hours or something like that. Keep in mind, you don't volunteer for many hours a week. It's probably 4 to 10 a week. So it's going to take some time to get those hours. But we typically recommend a little bit more than that, 150 to 300. If anyone has heard of the Pathmaker internship at Palomar Hospital, in order to get their, I don't know what it's called, but to complete their program, you have to complete 240 hours. The reason why it's great to get a lot of hours is you'll have more to talk about in terms of, why do I want to be a doctor? Why do I want to be a nurse? You'll have more patient stories to share with admissions committees. So that's really important. Number 1, they're going to ask you, how do you know you want to do something? You need to have examples of you working in healthcare. Number 1. Number 2, I'd say the next most important thing is service. So this is important for every health profession. Now, what do I mean by service? It's not just volunteering. It's about the community you're trying to serve. So for example, service is about working with disadvantaged communities, vulnerable populations, underserved communities, any community that doesn't have access to resources. So it could be homeless, it could be refugees, it could be students at a low-income high school. Whatever it is, they need to know you care about people, that you have empathy and compassion. And this is one good way, like strong way to demonstrate that. So service, again, I don't want you to see this as a checklist. I want you to see it as like, how can I fill these buckets of activities? What else can I do that's important to me? At the end of the day, you should really pick something that is meaningful to you, not something that looks good on your application. Think of a community that you want to work with, that you want to support. So again, this isn't a checklist. It's a general idea of what we see on applications that make people strong. The third thing, research, not required, but do a lot of students at UC San Diego do it? Absolutely, 100%. We just have so many research opportunities here that you can find on Handshake, you can find on Real Portal. If you do research, I would say do something that you're truly interested in. Again, it goes back to, what are you passionate about? What are you curious about? Don't do research to check off a box. They know when you do that because you probably won't be excited to talk about it, or you might not have much to say about it. So again, I would only do research if it is something you're interested in. But again, just to give you the data, a lot of our students who apply to med school specifically have done research. And then the last bucket I want to highlight is leadership. So leadership is anything where you're in charge of something. You've managed something, you've coordinated something, you've organized something. Maybe you were an IA or a TA or a tutor. Basically, you were leading something. And whatever field you decide, even if you're like, I don't actually want to do healthcare anymore, you will need leadership in any job, whether you're a lawyer or you work in business. So I encourage all of you to find leadership roles. If you're not, it doesn't have to just be a title like you're the president of a student org. You should be able to demonstrate leadership abilities and skills like teamwork and communication and those kinds of things, problem solving. So those are the 4 buckets we generally say to try to fill in order to build your application. Keep in mind that these things are a lot of work. You really want to balance it with your course load. You don't want it to impact your GPA. So for the freshmen, the first years, I typically tell them like to ease into your first quarter here at UC San Diego. It's fast paced, it's dense and heavy and a lot of information. It's more important you focus on your grades. Transfers, I'd actually say something very similar because you want to adapt to the new quarter system, which is very different from the semester system. So it's important to focus on the grades, the academics, at least for the first quarter. Well, always, but mainly for the first quarter. I don't want you to overload yourself with all these different things. But part of why I want you all to create a timeline is because you might realize it's going to take more time than you actually thought to do all these things. And to not be afraid if you need to take a gap year or anything like that. Once you start mapping it out, once students start doing that, they realize, wow, this is a lot that's expected of me to apply. And you saw the numbers, how competitive it is. So take your time building the application. And again, that's why I say timeline is everything. Also, one thing to remember, rule it in or rule it out. And what I mean by that is the sooner you get into a clinical setting, the more you're going to realize if this is truly for you. So if you haven't been in a setting and you're 100% sure you want to go into healthcare, I would want to know that you actually did something before to see if that changes your 100%. So again, if anyone has questions, feel free to chime in.
I have a question.
Oh yeah, go for it.
So I had heard, I don't know if it's true, I want you to confirm that to me. Is studying abroad actually helping applications for med school?
So it's definitely not going to hurt you. It's more about, I wouldn't use it as a strategy to get in. Like just studying abroad is not going to get you in med school. It depends what you do while you're there, but sure, if you're volunteering while you're there, if maybe you're shadowing a doctor while you're there, if you're doing some service work, absolutely. It'll give you an opportunity to say, hey, I actually saw what the healthcare system was like in Spain compared to here. And you can talk about it, sure, that would definitely help. But yeah, it's just mainly making sure you have something to say about it versus just doing it. Does that make sense? Okay. Anyone else have any questions? Okay. So this is the last part, which is finding relationships. And it's really important for all of you to find someone who could be your mentor. And I don't mean that you need to request a mentor. I just mean find someone that you actually like and would like to learn from. I'm sure you've all had professors that they gave a really good talk, or they wrote a book that you read, or maybe you really liked that last lecture. Whatever it is, for some reason they resonate with you, those are the people you want to get to know more. Because when you're genuinely curious about someone, this goes for your friendships too, it's just easier to develop an authentic relationship. And so it's really important to find people along the way that you can talk to about your path, whether it's a professor, a physician, someone because eventually you will also need a letter, but I don't want you to see it as like, oh, I need a letter from this person. I want you to see it as like, what can I learn? How can they teach me something? So different ways of getting to know someone is participating in class, taking smaller classes. If you're a TA or an IA, doing research is a good way to get a letter because they really get to know you. Coffee or dine with a prof, to be honest, I'm not sure how that's working right now. But if you all go to your colleges, they have coffee and dine with the prof vouchers. I'm assuming they're doing something virtual, but basically what it is you just set up a short meeting with someone and get to know them. I know it's a little awkward on Zoom. It's not the same as taking them out for real coffee, but I've never heard someone say no to these requests. So again, it's really about identifying someone you actually want to get to know, not just someone that you got an A in their class. That's just not enough. You want someone to know you in a way that they can speak to your communication skills or your perseverance or your capacity to improve, anything like that. You want them to get to know you. So keep in mind, relationships take time to build. And so that's why I want to plant the seed for you all to start thinking about, who do I want to get to know in the fall? Or maybe if you're taking summer session, who do I want to get to know while I'm, taking classes? So this is important because oftentimes when people are getting ready to apply to med school, to dental school, vet school, they come to me and they're like, I don't know anyone. There's nothing I can do for you at that point. So you really want to find ways to get to know people. And I'd say, depending on what health profession, you'll need more or less letters, but minimum 3. So, which is a lot. So just keep that in mind. Really start practicing building these relationships. So for just letting you know, I teach a med school prep 101 class. This will be in winter 21. And also, I will get to your question in a second, Sarai. It's a class that is really open to anyone. It's just we do prioritize certain students. Transfers are welcome too. But for example, for this winter, we would prioritize sophomores first because that's their last chance to take the class. And then in the spring, we prioritize freshmen. And in the winter, we'd also prioritize transfers as well. But this is specifically for med school, and we have lots of guest speakers, Dr. Galuma from the School of Medicine, a lot of alumni, physicians, but it's specific to medicine. So if anyone's interested and wants more information, you could ask me, but usually you have to just apply to get into this class. It's not a long process, and we just want to know you're serious. So before you can't just register for it. We need to like kind of clear you. But yes, Sarai, did you have a question?
Yes, hello, my name's Sarai.
Right.
And my question was pertaining to the letters of rec. So for those letters, do they have to be from specific people?
Good question. So it
Or
depends. So for example, if you are applying to med school, generally you want 2 letters from a science professor. A science professor is biology, chemistry, physics, or math. That's what they would consider science. But honestly, I would also say engineering or computer science would probably be in there too. Then they want 1 non-science. Non-science is everything else. So think about sociology, history, English, humanities, a language class, basically a soft science, like psychology could work, sociology. That isn't the rule for every med school, but chances are you'll be applying to a med school that does want that. So that's a good rule to follow. Another thing, if you do research, definitely a PI. If you have a job, your boss maybe. If you were a TA, the professor. If you are applying to pharmacy school, a pharmacist. If you're applying to dental school, dentist, you don't necessarily need an MD letter from, but it won't hurt you either. The thing is, keep in mind, it's about quality of letters. You don't want just a bunch of mediocre letters. It's better to have 3 really solid letters where people know, like, can really say, this person is going to be an excellent physician, and here's why. Besides them doing well in my class, they're really great communicators. They have a lot of empathy and compassion. You want someone to be able to talk about you like that. Does that help answer your question?
Yes, thank you.
I have a question as well about the recommendations. Can they come from a community college professor that we had in the past?
Yeah, absolutely. Great question. 100%. Absolutely. The only thing is, since you're going to be here, you want to make sure to get letters from here too, just because this is your most recent time. But absolutely, any letter is fine as long as it's a good letter and it says more than, Emily got an A. It has to be more than that, but yeah.
Cool. Thank you very much.
You're welcome.
I have a quick question. How would you ask a professor, I mean, in the way like what to write? Or should I just ask them for a letter of recommendation for med school if I want to go to med school?
Yeah, so usually what I would do, so actually on our website, and I'll show you this at the end of the presentation, but there's a guideline you can actually send to them, and it tells them how to write the letter. But that's only for med school. Like, I haven't seen it for other health professional schools. Generally, before you ask for a letter, first you need to make sure you've actually built a good relationship. If you feel that you have, then I would, depending on what your relationship is, if you do mostly email, I think it's fine to ask over email, but especially because we can't meet in person anymore. But a professional, let them know. So we've been talking for the last year. I just wanted to let you know my plan, which is I plan on applying to med school during this time. And I was wondering if you'd be willing to write me a strong letter of recommendation based on, how well you know me. And then you could add something like, if it would help, I'm happy to set up a meeting to talk about this more, or provide my resume. Usually they want information, because you want to make it as easy as possible for someone to write you a letter. So usually when I've done it, I interview them. And then of course you want to see the resume. And oftentimes they want to see a personal statement from you, like what you'd actually have to write for med school. So even a draft probably would be okay, but I wouldn't assume they're going to write it. So I wouldn't attach it. I would just let them know, this is my plan. Would you be willing to write me a strong letter? If so, I'd be happy to meet for 15 minutes to talk more about it. Something really easy that's hard to say no to, like that you just want to talk to them really quickly. If it would help, I'm happy to send you more materials like my transcripts and my resume, and then go from there. But, short and sweet, but professional. Hopefully they'll recognize your email. Like, they should know who you are, by your email or your face or something. Does that help?
Definitely, thank you.
You're welcome. Okay, so feel free to ask more questions. So how can we help? So I want you all to think of HealthBeat, which is the pre-health advising center at the Career Center, as your GPS. So what that means is, wherever you are all on a different path, because you're probably in different majors, you're in different stages of life. Some of you are first years, some of you are third years. But wherever you are, we can provide you with directions. And oftentimes what happens is people get lost, like we all do when we're driving, right? You take a wrong turn, or you get to OChem and something happens, or you don't get in the class you want when you want to, so it changes your timeline. That's okay. Just know that we are there to reroute you, and we can all of this is possible if you're willing to put in the work. That's the bottom line. If you really want to do this, and you're willing to take all these classes and get all these experiences and get all these letters, you can do this. So just get connected to us soon though, because the sooner you're connected, the sooner we can work on your timeline. You know, people come to us really late and it's hard to fix it later versus like, let's plan out a timeline. And like I said before, it's okay if it changes. It almost always is going to change. It doesn't matter. It just means you need some direction to follow. So, or roadmap. So I want you all to think of HealthBeat as that GPS for you. So how we can help you too is I can get a sense of, tell me what you've already done. What have you taken? And then also identifying any gaps. Here's what I see that's missing in your application. I would say start like working on it. I could also help you find ways to make it better, to strengthen your application. But we handle everything from explore, prepare, and apply. So if you're not sure you even want to do this, we can still help you with that. We can help you with advising, coming up with a timeline, just general career advising of exploration. Once you decide, you know what, I absolutely want to do this, I know I want to do this, then we can help you with the prepare section. So everything that I already talked about with prerequisites, experiences, service, leadership, research, all of these different things to build a strong application. And then when you get to the application period, then that's a whole nother level. We can help you really plan out your test prep, whether it's MCAT or PCAT or GRE or DAT. Help you write your personal statement, letters, interviewing, whether or not to take a gap year. So we can do all of these things. We're here for you. You just need to make sure that you come to advising, come see us in advising, you know, follow us on Facebook, check out our website. There's also different types of advising. So if you have quick questions, you can email us at healthbeat@ucsd.edu. We also have peer support, and I really strongly recommend you meet with peers, because peers are just like you. They're pre-med or pre-health. They've gone through a lot of the classes that you will be going through. They can give you insight on what classes to take, in what order, with which professor. They just have inside information because they are students just like you. And then myself and Nadia are the pre-health and pre-med advisors. So if you're a junior and senior, you can schedule an appointment on Handshake. For everyone else, you can see us, but it's usually going to be in a drop-in capacity. There are some other advisors that do drop-ins for first and second years. Actually, anyone can come to drop-ins, but I just recommend this juniors and seniors just make an appointment, because it's you usually need a longer amount of time since you're further along. But drop-ins, again, I'll show you this at the end, all our resources. So we have a drop-in advising calendar. I'm going to show it to you. I'll put the link in the chat so you all can bookmark that page. And this is a live Google Calendar that will tell you who is available and at what time and what date, including myself and then the peers. And it'll have like in parentheses who's a peer and who's a professional advisor. But I recommend seeing both of us because they have some insight that I don't have. So I think it's important to connect with them too. But I'll show you that at the end. And then this is our website, healthbeat.ucsd.edu. Lot of good information here. It's a lot. It's hard to comb through, but it's worth taking a look at the website. And then again, I kind of talked about some of our events that will be coming up in the fall. The HealthBeat open house, usually that's in person, obviously, all these. So I don't know how that's going to go, actually, the open house. We will do a transfer transition seminar for anyone that's a transfer, but like I said, anyone's welcome. That will be during week 1. It will be a Zoom. And then for freshmen, or before you come to any type of one-on-one advising, you have to go through a group advising session first. And everyone will get this email, so don't worry, explaining what you need to do before you get your one-on-one appointment. So again, these are our I'm Jessica and Nadia. She's not here today, but you can visit us at healthbeat.ucsd.edu. Our email address is healthbeat@ucsd.edu, and then you can follow us on Facebook, and then I'm going to show you I don't know how to get out of this. I want to show you our website. So if you go to healthbeat.ucsd.edu, it looks like this. So this is the page I want you to bookmark. So you go to advising. Actually, I'll put in the link in the chat. Oh, sorry, I didn't see all those chats. So I just put a link. So just bookmark that page. And from here, you can see there's no drop-ins really because it's the summer. But if you need an appointment for whatever, like Nadia does it, so you can look there, but just email HealthBeat and they'll set something up for you. Also, it's important, all this red up here, just because of COVID, you can click on all these. There's information on how to get experiences during the pandemic. So definitely click on all these, save those pages. And yeah, and then the last thing I want to show you is just how to navigate the website. So let's say you're medicine. Usually you are going to be here. If you want to go to med school, you go to the prepare section, and this walks you through everything I kind of talked about. Everything from research, prereqs, AP credit. There's a sample timeline here that you can look at what a 4-year timeline looks like. Taking a gap year versus not taking a gap year. And then you can also go to the apply section. And this is where you're going to find more information of what to do when you're ready to apply. So it's going to have information about the MCAT, how to write your personal essay, how to get letters. This is the guideline I was talking about. Fee assistance program, how to select schools. I created a demo of how to look at schools, how to submit, just all this information. But honestly, I wouldn't go to the apply section until you're ready. You don't need to know this information right now. It's too much information. So that's all I have. I'm gonna just check the chat real quick. Yeah, so when I say PA, I mean physician assistant. Oh, I guess we're recording it, right, Angela? Yeah, so you all can rewatch it. POD, yes, podiatry. Did the link for the calendar ever get sent? What is that? Did you? Oh yeah, I think it's like 2. It's in there if you just scroll up, Jennifer. Letters, yes, they generally come from professors, or yes, that's really important. You need letters from professors. Okay, I think any other questions? Sorry, I'm chatting. I'm just seeing if someone else has a question. So how do W's look regarding, okay, good question. W's, it depends. I mean, if you need a W, take a W. It's better than an F or a D. But I would say you don't want to have a ton of W's because it just raises flags. So this is my advice to all of you is you want to raise as few flags as possible when you're applying to these schools. And what I mean by that is you want to be under the radar. Like if you need a W and like, let's say you were sick or something happened or someone in your family had COVID, I mean, that's totally understandable. You may have to explain it. And the only place you'd have to really explain it is in your personal essay. Like, let's say you had to withdraw from an entire quarter. Yes, it's something you probably want to address. If it's 1 or 2 W's, honestly, I don't think that's a big deal. As long as the rest of your application is solid. So if you had a decent GPA, you just had a few blips here and there, you have a lot of great experience, a lot of good letters, I wouldn't worry about that. It's truly a holistic process. They really look at the whole picture. I've seen perfect GPAs not get in because it's not just about that. But at the same time, it is important because they need to know when you get to med school, when you get to dental school, vet school, PA school, that you actually can do it. They don't know you. So the only way they know you can do it is by your GPA or your MCAT score or your PCAT score. But that's why I always tell students, before you invest in this, like, make sure you want to do it because it's a marathon. There's a lot of training that goes into this. So really make sure you want to do it for yourself, not for your parents or not for the money or not for the prestige. It's okay to change your mind. But I truly believe anyone can do this if you do all the work. It just takes some time. It's a lot of work. Let's see. Yeah, and if you get a W, yes, you can retake the class. I think there is a limit though. So check with your college. And also I might as well address the pass, no pass thing. So pass, no pass generally is not something you should do for science classes. But this is an exception, right? We're in a global pandemic. They're not going to hold that against you. The only thing I would warn you about is, you know, in the fall, especially since most of you already probably hopefully have adapted and transitioned, I would, at some point, you're going to need to show, they're going to need something to evaluate you by, right? So if you had all these P, no Ps, it's going to be hard to evaluate you. But a few, yeah, I think it's fine. But generally, I would say you want to take any biology, chemistry, math, physics for a letter grade. Oh, so in terms of professors that are good to take, that's when I would talk to the peer advisors. So I wouldn't know that as much. If you're trying to decide, they know everything. So go to talk to our peer advisors. They're not working over the summer, but once the quarter starts, we'll definitely have them. But that's generally the best place. Pre-med 2, another, you know, honestly, I don't think it's about practicality. It's really about, what do you want, right? Like, if you don't want to do it, don't do it. Honestly, the people that take my class, when you hear from our speakers, they'll tell you the same thing. You know, I didn't get into this for the money because there's so many other things that go along with it. You really have to have a passion for medicine, passion for people, service. But generally, I would say it depends, pre-med to what. If you wanted to go towards another health profession, it's possible, but they're all different. So like, for example, if you wanted to do physician assistant, PA is probably it's actually more competitive than med school, and that's because there's not a lot of PA schools, and they don't take that many. They take like 60 students versus med schools will take 125 up to 300. So that's a lot. And PA school's only 2 years as opposed to med, which is 4. But I still treat PA like it's 4 years because you can't just apply to PA school. You actually need to work for a year or two because what's important for PA school is to make sure you have a lot of hours. They expect around 2,000 hours, which is a year full-time working in like as an EMT or CNA or something like that. So it ends up kind of being like a 4-year thing. Does that make sense? Where you have to like work before you even apply. Nursing, a whole different thing too. So if anyone's interested in nursing, usually I'd say we're not a nursing school. If you can, I would go to a nursing school. But if you're like a junior or senior and you decided actually now I want to be a nurse instead, yeah, there are ways. You just have to apply to an entry-level Master's of Science in Nursing program. But you don't need a Master's in Nursing to be a nurse. You can do that in 4 years and be an RN. So here's another question. Is there a program that connects us as undergrads? Yes, great question. So there is a program, and again, this is why I want you all to follow our Facebook page, because there's a group called PAMS. That's the acronym. It stands for Pre-Med Advising for Medical Students from the School of Medicine. It's usually first-year med students. They have it once a month. It's once a month. It's like the first Monday of every month, but that will be on our events page on Facebook. So just check there. They're going to have one, I think, in August, and then in, once a month, September. So definitely, I'm very connected with them. If you don't see anything and you still have questions, just reach out to me and I can let you know. Pharmacy also does the same thing with Skaggs School of Pharmacy. So anyone interested in pharmacy, this will also be on the calendar, but it's I think it's once a quarter. Med does it a lot more. Pharmacy is only once a quarter. And we only have those 2 schools. So other than that, and then we work with Dr. Galuma. He presents to my class, but we also do a whole presentation probably in the spring on getting into the UCSD School of Medicine. Same with UCSF. We also do that in the spring. So yeah, just stay connected to us. We also work with a lot of alumni that can help all of you and connect you to alumni, whether it's a PA, nurse, physician, MDDO, dentist, things like that. Get connected to your student organizations, really find your people, your tribe, peers. I know it's a tough time right now. This is not an ideal learning environment. It's not an ideal working environment for a lot of staff and faculty. But one thing that I know they're going to ask you wherever you decide to go is, how did the pandemic impact you? And so really using this as an opportunity to show that you're resilient and that you can adapt to these trying times. But also to, throughout there too is, at the end of the day, it's so important to protect your mental health more than anything, your mental and physical health. You can't do anything without that. So really making sure you fiercely take care of your well-being. This can wait. Like if you need another year, don't put all this pressure on yourself. If you need a little bit more time or you need a summer, it's really hard to recover from a low GPA. So try to prevent that. Like don't overload yourself. That's why I say for all the freshmen, anyone new, like transitioning as a transfer, give yourself some time to adjust, especially now. Like burnout is a real thing. And, you going straight to med school too, it's just going to get tougher. And so really taking your time. I know students that have taken multiple gap years because they weren't ready, not just with experience. They didn't have the grades yet, or they needed to retake some classes, and they eventually got what they wanted. Time's going to pass regardless. So just, again, like I can't emphasize that enough. I want you all to really take care of yourselves first, and take your time and make sure this is what you want, because it is really tough, but doable. like I said, if you follow a plan and if you plan accordingly. So any final questions? All right. Well, thank you all for your attention. And then Angela, will you be able to give me like everyone's contact info just so I know who's on the call?
I'm not quite sure, but I can reach out to CASP staff.
Oh yeah, I think she said she was, yeah. Because I could all like send you all something too. I think that one link should take you to a lot of places. But don't hesitate to reach out to me. Oh, let me send you my email in the chat. And I know, you know, you might have questions later, or, but just know, like, this is an overwhelming process. You are not the only ones, and that's why I want you all to like take time and just reach out if you have more questions. But have a great summer and look forward to meeting you all in the fall.
Thank you so much.
Thank you so much.
Yeah, my pleasure. Great to meet all of you.
Yeah, can't wait to actually get to come in and see everyone.
I know. I hope that happens soon.
Right?
Yeah.
All
Yeah.
right.
Thank you.
Thanks, everyone. Take care. Have a great summer.
Thank you.
Bye.